This is my continuing coverage of the health care bill. We are still on page 15, and we're going from page 15 to 16 in this video. And this is going to actually be, we're going to cover, this is part 12, and in part 13, I'm actually going to show you my computer screen so that you can actually see the wording on part of this health care bill, and I'll explain that a little bit later. But first of all, on page 15, you're supposed to be getting a summary of your health care coverage, and this summary comes, is supposed to be given to you when you are an applicant at the time of your application. You're supposed to get this if you're an enrollee prior to the enrollment or re-enrollment. This would mean if you were at a workplace and you're enrolling into a health care plan at your workplace, you're supposed to be getting this document. And if you're supposed to be re-enrolling, you're supposed to get this document again, so on and so forth. And a policy holder at the time of issuance. Okay? Now, if you go down a little bit further, they start making a reference to the I'll say that again. The Employee Retirement Income Security Act of 1974. Good luck trying to find that one. It took me forever to find it. So, since it took me forever to find it, I'm going to provide you with the details that they're referring to. This was part of Section 3, Part 16. I'm going to read this word for word because it's going to be tough for you. It's not that you can't find it, because I did, but it would be real tough to find it, so I'm going to save you the trouble. The term administrator, according to the health care bill, means the following. The person specifically so designated by the terms of the instrument under which the plan is operated. If an administrator is not so designated, the plan sponsor, or in the case of a plan for which an administrator is not designated and a plan sponsor cannot be identified, such other person as the secretary may by regulation prescribe. Now, the term plan sponsor means the employer in the case of an employee benefit plan established or maintained by a single employer, the employee organization in the case of a plan established or maintained by an employee organization, or in the case of a plan established or maintained by two or more employers, or jointly by one or more employers, or jointly by one or more employers and one or more employee organizations, the association, committee, joint board of trustees, or other similar group of representatives of the parties who establish or maintain the plan. Now comes the even trickier part. They want you to reference Section 102 of the Employee Retirement Act of 1974. Well, that's even harder to find than what I just read to you, and I will show you that in my next video. This refers to Title 29 of U.S. Code, Section 1022. I'll say that again. If you want to find this information for yourself, you have to look up Title 29 U.S. Code Section 1022 or 1022 or whatever you want to call it. Section 1022 is what you're looking for. Alright, now if some healthcare provider does not give you this summary thing that we've been talking about in the last couple of videos, they can be fined $1,000 for each enrollee that they did not give this summary documentation to. That's pretty expensive. Alright, and then they go on to talk about these terms, these insurance-related terms that have to be across the board. It doesn't matter what healthcare provider gives you this summary document. They have to define these terms the same way. They can no longer give different definitions for these terms. The terms are premium, deductible, co-insurance, co-payment, out-of-pocket limit, preferred provider, non-preferred provider, out-of-network co-payments, usual, customary, and reasonable fees, excluded services, grievance, and appeals. And you say, well, what's such the big deal? Well, on some of these terms, it wouldn't be such a big deal because they're kind of pretty much defined the same way no matter what healthcare provider you go to right now anyway. But what one plan describes as an out-of-network co-payment thing, another plan may describe that as an in-network thing. Okay? So what one plan would say is out-of-network, another plan could say it's in-network. Well, now the Secretary of Health and Human Services is going to say whoever provides you with the health insurance has to define the same way out-of-network and in-network. A preferred provider and a non-preferred provider. And believe me, there are healthcare plans that define that differently today than what they're going to have to define it as when this whole thing takes full effect. Okay? So within 2 years, you're going to know what is in-network, what is out-of-network, what is a preferred provider, and what is not a preferred provider. And one healthcare company can't say that this is a preferred provider, and another one goes on to say it's not. They're not going to play that game with you anymore. Okay, as for medical terms, this gets even more interesting. All healthcare providers have to define this the same way. Hospitalization, hospital outpatient care, emergency room care, physician services, prescription drug coverage, durable medical equipment. Yeah, one healthcare provider could say, well, that's a piece of durable medical equipment. The other one could say, well, no, it's not. Not anymore. Secretary of Health and Human Services will tell you which is and which isn't. Home health care, skilled nursing care. One healthcare provider can say that's skilled nursing care. Another one says, no, it's not, and they don't have to pay for it. Wrong. Secretary of Health and Human Services will now say what is home health care and what isn't. Rehabilitation services, hospice services, emergency medical transportation. One healthcare plan could say, well, an ambulance is emergency medical transportation. Another one could say, well, no, it's not. Not anymore. Okay. In my next video, I'm going to show you Title 29, U.S. Code, Section 1022. And that will take us to page 16 of this new health care bill. I will tell you more in a future video, so stay tuned.